Are you suffering from tightness and stiffness in one side of your lumbar spine? In this video, I'll be discussing about the Quadratus Lumborum, the anatomy, physiology, and different ways to strengthen, lengthen, and support through Pilates, yoga, and physical therapy to finally fix the tightness, stiffness, and pain on one side of your back. So it's also a little bit confused for most people because they think it's just the back muscle, but it has a purpose of different functions that will help support your lumbar spine. When you're having pain on the Quadratus Lumborum, it gets tight and stiff and it almost looks like a crunch muscle. And the purpose of this muscle is to one of the purpose on each side is to side flexion of your body. But when they come together, when you utilize both of the muscles at the same time, the function of this muscle is to extend your back. At the same time, it also hikes the pelvis up. So when you have spasm and stiffness, it really crunch up and one of your pelvis goes up higher. So it makes it your pelvic alignment irregular, what we call lateral pelvic tilt, because of the stiffness and tightness of this muscle. Most patients who have tight Quadratus Lumborums may be because they've been sitting a lot and it causes stiffness in that area. And the number one factor as well is weakness on your hip. So if you have unstable hip, if one side has a weaker buttocks, so what will happen, your Quadratus Lumborum muscle will stiffen and tight and overwork to compensate the weakness on your gluteal muscles. So most patients who have injury on their hip joint, like labral tear or having dead butt syndrome, which is a weakness on your gluteal muscles, and you're not activating your glutes when you walk, stand, stair climbing, then your Quadratus Lumborum ended up working harder and causes the stiffness and tightness. So no matter how much you stretch these muscles, and if you don't fix the root of the problem, which is the weakness on your glutes, then you will be in a never-ending battle of fixing and releasing the muscle. And no matter how much you stretch it, won't get better.